Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness, and I want to tell you about a patient I saw last week because her story is probably closer to yours than you'd expect. She came in after a car accident. Her attorney had told her to get checked out, which is exactly the right call, but she was nervous. Not about pain, about the adjustment itself. She'd watched videos online, the ones where someone's neck gets twisted and there's this loud crack, and everyone in the comments is either amazed or horrified. And honestly, those videos had made things worse for her, not better. So before we did anything else, we just talked. And that conversation is the reason I'm making this video today. Because if she felt that way, I know a lot of people searching right now feel exactly the same way. So let's slow down, go through what chiropractic care actually is, what happens during an adjustment, what we treat, what we don't treat, and what you can actually expect when you walk through our door. No rush, no pressure, just the real information. Let's start with the adjustment itself because that's where most of the anxiety lives. A chiropractic adjustment is a controlled, precise movement applied to one specific joint in your spine. That's it. The goal is straightforward. Restore normal motion to a joint that's gotten stuck or restricted and take pressure off the nerves and soft tissue surrounding it. When a joint isn't moving the way it should, the tissue around it gets irritated. The muscles nearby tighten up to compensate, and the nerve signals running through that area get disrupted. That's where your pain is coming from. That's what we're correcting. Now, the sound, the pop, the thing that's in every video and freaks people out. That sound is gas, specifically dissolved gases inside the fluid that cushions your joints, releasing when the joint moves through a specific range. Same exact thing that happens when you crack a knuckle. Same mechanism, same physics. Nothing is cracking, nothing is breaking, no bones are being damaged. It's just pressure changing inside a fluid-filled space. Once people understand that, the sound goes from terrifying to completely unremarkable. And sometimes there's no sound at all, which is also completely fine and completely normal. So now let's talk about what we actually treat, because this is where I want to be honest with you. After a car accident, there's a very common set of injuries that fall squarely in our lane. Whiplash is the big one. That sudden back and forth force on your neck causes the muscles, ligaments, and joints to get stretched and strained in ways your body wasn't designed to handle. Neck pain, upper back pain, lower back pain tied to the impact, all of that is something we work with every day. Headaches that are coming from tension and restriction in the cervical spine, meaning your neck, are also something we see significant improvement with in a chiropractic setting. Here's where I'll be direct with you about scope, because I think this is actually one of the most important things a provider can do. If you come in and your imaging shows a fracture, we are not the right first stop. That's a referral. If you've got a disc injury that's severe enough that it needs a surgical conversation, we will tell you that clearly and will point you to the right specialist. If you're showing signs of a neurological emergency, certain patterns of weakness, numbness, loss of bladder or bowel control, that is an emergency referral, not a chiropractic visit. Knowing what's outside your scope and saying so clearly is part of the job. We take that seriously here. For the patient I mentioned at the start of this video, by the time we got to the exam table, she wasn't nervous anymore. She just wanted to know what we found. And that's usually how the first visit goes when we don't rush it. Here's what a first visit actually looks like at TaylorMade Health and Wellness. It's mostly a conversation. We go through what happened, how you're feeling, where the pain is, what makes it better, what makes it worse. We do an examination. We talk through what we're finding in real time so you're never in the dark. If we're going to take any imaging, we explain why. And if we're going to do any treatment that day, we explain exactly what we're doing before we do it. Nothing happens without you understanding it first. We also want you to know that care here is available in English and Spanish. If you were injured in an accident and you have personal injury protection coverage, also called PIP, those visits are billed directly through your insurance. You're not coming out of pocket. You are not navigating paperwork on your own. We handle that side of it so you can focus on getting better. Now, let me ask you something directly.